Hello, my name is Albert Messiah, student at the NTPD program. Today I'm going to present my patient case as he was referred to me for a comprehensive assessment and a plan of treatment. Mr. Richard Taylor is a 56 years old African American male and he is married for 24 years and his wife passed away last year. He speaks English and he works as an IT specialist. His main complaint today is that he exhibits active signs and severe signs of worsening of depression status and COPD status. His current social history is that he smokes tobacco on a daily basis. He smokes one pack per day. He drinks alcohol on occasional basis. He doesn't take or use any illicit drugs. Also, he doesn't exercise. However, it was noted that he had increased the caloric intake in the last 3 months and he increased in weight by 15 pounds. His current medication list include atorvastatin 80 milligram oral tablet. He takes it once daily. Metoprolol succinate 50 microgram and he takes it one tablet by mouth daily. Fluticasone inhaler 100 microgram per inhalation and he inhales one puff twice daily. Albuterol 90 microgram per inhalation and he inhales two puffs every 4 hours as needed for shortness of breath. He takes over-the-counter medication, aspirin, oral tablets, 325 milligram, and he takes it once daily. Also, he has allergy to adhesive. My current assessment of the COPD status is that first he had a history of COPD and he had COPD exacerbation last year in March, which was treated without leading to hospitalization. In today's visit, he didn't exhibit any signs of bronchitis with his COPD. However, uh, his COPD was associated with severe shortness of breath, especially during walking and during exercise, which limited his ability to exercise on a daily basis and it caused weight gain with time. The physical exam showed normal pulmonary function, blood eosinophils count of 50. A spirometry and CAT assessment was done to further evaluate his COPD status. The CAT assessment score is 21, and my assessment of his current COPD status according to the GOLD guideline is that I would classify him with moderate severity COPD category group B. The patient's current COPD status is not well controlled. His current therapy of the COPD and my assessment of his current therapy, he takes fluticasone 100 microgram per inhalation and he inhales it twice daily, and the albuterol inhaled two puffs every 4 hours as needed for shortness of breath. Is not following the current guidelines of treatment of COPD. Is not recommended by the current guideline to use a steroid medication in this patient case. My recommendation is to start the patient according to his current classification per guidelines is to start him on a combination inhaler of long-acting beta agonist and long-acting muscarinic agonist. My plan of treatment is to discontinue the inhaled steroid as it might be associated with increased risk for pneumonia and it might have a reduced beneficial effect in patients that are current or heavy smokers. And I recommend to initiate a combination of LABA and LABA inhaler as the patient is highly symptomatic with severe shortness of breath. his CAT assessment is above 20. In addition to starting short-acting beta agonists for use as needed to relieve acute COPD symptoms, my recommendation is to start an oral Ellipta, inhale 1 puff by mouth every 24 hours, and to continue with the albuterol inhaler, to use it 2 puffs every 4 to 6 hours as needed for shortness of breath. It is recommended to monitor with this patient and the symptoms, the improvement of symptoms, and to monitor the spirometry and the CAT score again, and to schedule a follow-up appointment after 4 to 6 weeks. Also, the patient should be educated on the importance of smoking cessation, and he should be educated on the availability of different pharmacological therapy to quit smoking, also improper usage of inhalers and how to use the inhaler. The second complaint is depression. My assessment of the disease, as he stated that he suffered severe depression since his heart attack 3 years ago, which has been consistent over the past 6 months. The patient stated as well that he tried citalopram 3 years ago and it did improve his symptoms, but it caused side effects for him. It caused sexual dysfunction and diarrhea. The patient, and this is my assessment of the disease, the patient is experiencing 5 or more symptoms of the DSM criteria of diagnosis of depression, which includes depressed mood, lack of interest in his hobbies, significant weight gain in the past 6 months. His HAM-D assessment was done to further evaluate his depression status, and the patient scored 16, which indicates the patient has moderate depression. His current therapy, the patient is lacking therapy, is not taking any medication to treat his depression. The planned therapy is to start citalopram 40 milligram. Also, the patient needs to start as well psychotherapy and cognitive therapy as well. My recommendation is to start citalopram 20 milligram for 1 week to avoid the same side effects that happened to him previously, and then after 1 week to continue on citalopram 40 milligram once daily. Also, I want to augment this therapy with bupropion 150 milligram oral tablets once daily, as it will help with the smoking cessation and the SSRI or the citalopram induced sexual dysfunction. My recommendation as well is to continue monitor the patient for medication side effects, the also the improvement of the depression symptoms with time, and to monitor blood pressure. Also, I would educate the patient on medication side effect and the importance of compliance with the medication, and not to expect any improvement in symptoms unless the medication is taken for around 6 to 8 weeks. I would schedule as well a follow-up appointment within 4 to 8 weeks. Thank you so much.